Okay, so welcome to the webinar. Luke, do you want to say a few more things, or do you want me to just get started?
I'd just like to welcome everybody and thank everybody for joining. Again, anybody that's just dropped in there, we are recording the session. It will be available. Everybody that's on that has registered and maybe that haven't been able to join us, we will be sending it out. It will be available via a link, also via probably both websites. So yeah, without further ado, I'll hand you over to the guys here in WheelAir, and thank you again.
Great. So welcome everyone. I'm Corien. I'm the founder and CEO of WheelAir, and today I'll be doing the presentation with Nienke. She's sitting next to me, but with her own screen, so you can see her well. Nienke is our clinical research coordinator, and she'll be taking on parts of the clinical side of this presentation. I'll be giving a bit more background information, and also at the end we'll dive into the products and have a little discussion as well where needed. So I created the WheelAir almost 6 years ago now at university. So I had a supervisor who was a wheelchair user herself, and she told me that sometimes wheelchair users struggle with overheating. I have a business and fashion background, so not related at all, but I found this super interesting topic. And I learned of many people with a spinal cord injury, for example, who couldn't sweat below their lesion, but also other wheelchair users with MS, with cerebral palsy, who came to us and said, you know, we don't sweat at all, or I sweat too much, or heat and moisture is affecting the skin integrity. And I saw how cars were having cool seating. So I didn't understand why it wasn't being brought to the wheelchair user, you know, the people who need it most. And all I could hear, or all I was hearing, was people with, you know, water sprays or wet towels, ice vests, not going out during the day in the sun, for example, because they would get nauseous. And I thought, let's change that. So our mission is using the power of airflow to prevent heat and moisture-related issues for wheelchair users, while contributing to the conversation and education around the topics of heat and moisture and relative humidity in seating. Now, the conversation education is really important to us because we often find that symptoms of heat and moisture aren't recognized well enough, or not related enough to heat and moisture. And we want to help spread the word on that, which is also why Nienke has the rules. I'll ask Nienke to introduce herself to you guys.
Yes, I'm glad Corien started the company like this, because I'm a wheelchair user myself, and I had lots of problems with over sweating and overheating. But about my clinical background, I've studied medicine and currently finishing my research master's clinical epidemiology. And as a clinical research coordinator, I will help facilitate research for WheelAir and educate people about heat and moisture. And that's what we're going to do today.
Perfect. So what we've created is a clinical assessment toolkit. With this, we will give you the tools to help recognize symptoms, clinically evaluate your patient and your client, and then justify the decision as well. As we often see, you know, these projects are being reimbursed, but how exactly do you justify that? For that, we've created an index of conditions. We'll go through briefly after this as well. But basically, through case studies, through literature, we've learned what type of conditions are most inclined to have heat and moisture related issues. We've put them in a list, created a summary, and then for each of these, we've done an extensive literature review and made a summary of 2 pages. So for example, if you have a client who has cerebral palsy and heat related issues, then you can go to our website, find the literature review on cerebral palsy and heat, and immediately have an overview of all existing literature. We also update this on a regular basis so that we're up to date with new literature being published. We've also created a risk matrix, which we're going to go through today. Our risk matrix helps to give a score to your client in terms of heat and moisture related symptoms and other factors that might influence that, and will help you to see whether heat and moisture management is not needed, recommended, advised, and so on. It gives a tool to open that conversation with your client. We also have temperature and relative humidity test reports. This is something we've launched quite recently, just adding someone else to the team here, where we'll go through how much of a difference in temperature and relative humidity our products actually cause, both for the slingback and cushion cover. And at the end, we'll discuss how we're going to do that for custom seating, and then our case studies as well.
Yes, the index of conditions. There are a lot of conditions in which people suffer from heat and moisture-related symptoms. In general, are all wheelchair users prone to pressure ulcers due to the prolonged periods of sitting. But for instance, people with a spinal cord injury can't sweat below their level of injury. People with multiple sclerosis can have a temporary worsening of clinical signs and neurological symptoms. And they can have premature fatigue with heat exposure. And so there are a lot of conditions which are mentioned here. Autoimmune diseases, Ehlers-Danlos syndrome, epilepsy. So lots of conditions. We won't read through all of them, but do you have experience with one of these conditions?
Or questions about any of these conditions? No questions, but I see lots of nods for the experience. So that's good. We have a lot of children predominantly with epilepsy, I would say, especially in custom seating. You have some interesting facts about epilepsy as well, I always think.
Yes. Some people with epilepsy can have a seizure due to heat, because due to the heat, their threshold for getting an epileptic attack lowers. So they're more prone to getting an epileptic attack. So that's why lowering the body temperature will especially help in those children.
So for all of these, if you want more information, it's all on our website. You can get in touch with us. And if there are conditions that you don't see represented, please also let us know and we can do a deep dive into the literature for those as well. Of course, there's also a lot of non-verbal symptoms. A lot of our clients aren't able to communicate verbally. And with those, it's often up to the carer to figure out if this is heat and moisture-related issues or what the problem is. With one of our clients, he was in a care home, his cerebral palsy, non-communicative verbally, and he would, at the end of the day, often start crying and get really agitated. And they couldn't figure out for the longest time what the problem was. And his father would come pick him up and put him in the car and then drive with the windows open, and that like calmed him down because the airflow was cooling him down. And they figured out that way it was actually heat-related, the agitation. What we often see is scratching of the knee, scratching of the forehead. We have clients where they start banging limbs and stuff just to try to express that agitation. There's obviously visible skin on sweat, clothing changes that we often see, but also the physical state of the seating system. I probably don't have to tell any of you after a few years when you visit, you have to replace the seating system of the client. It has affected the foam, it has a smell to it. The seating system itself, there's bacterial growth sometimes that I see on it. So there's quite a lot of signs that we hope that you watch out for to recognize that this is actually a heat and moisture issue.
As you all probably know, there is a relationship between the humidity and the temperature and how your body perceives this temperature. That is listed in this graph and called the apparent temperature. This is the temperature your body feels. How higher the humidity is, how higher the apparent temperature is. So even with a low temperature, your body feels already a lot hotter with a higher humidity. This is relevant because due to sitting against the backrest, the humidity will increase. You can, for instance, think about wearing a backpack on your back in a summer day all day long. You will get sweaty and hot. Because the humidity and temperature increases. And it's also relevant because of the relationship between the environmental heat and the humidity and how it will, you as a wheelchair user, make you feel.
Yeah, one of the questions we often get is, we use ambient airflow and people say, yeah, but if it's like 35 degrees, will it still cool me down or is it just giving me hot air? And while the air is, the ambient temperature, was still taking down that relative humidity quite significantly, which gives you a cooler feeling and also cools you down. So that's something to bear in mind. Then onto the risk matrix. Before Nienke goes into the explanation of it all, the risk matrix is really made as a tool. You can also download it and it's front and back. You can print it out and laminate it. That's how we do it. So that you have a point of starting the conversation with your client. Because what we often see is you ask someone, oh, do you have heat and moisture related issues? They're like, no, I don't think so. And then you talk a bit further and after a few minutes, it comes out that, oh yeah, I actually don't do this, because I know I overheat. So people have adjusted their lifestyle to be limiting themselves in not going outside, not going into the sun, not doing certain activities, while we actually, want to promote a fuller quality of life where people are able to participate in more activities. So by giving these, symptoms a name and putting them on a sheet like this, we hope that this is something you can go through with your client or alone, recognize them, and have a point of starting the conversation to see, is this an issue, yes or no?
Yes, for instance, for myself, before I used the WheelAir, I would never go hand cycle to work in 25 degrees with full sun. But now I noticed myself that I could do that, but it's something I really forgot about because I was so used to not doing it. So it's really important to start a conversation. We developed this risk matrix together with clinicians, and it's based on the current state of research, literature research. And we validated it in our some of our patients. The risk matrix consists of 5 rows, and in each row you score your patient based on the current state of your patient. The first 2 rows are the most important, namely the heat and moisture / skin integrity symptoms. In the first row, we score the heat symptoms of an individual person, with 0 meaning no symptoms at all, followed by any heat discomfort, then onto a heat rash, so a skin rash due to the heat, muscle spasms or heat cramp. And if the environmental temperature becomes higher or you still stay in the heat, you can also get a heat syncope, which consists of fainting, dizziness, lightheadedness, and a brief loss of consciousness. The next step is heat exhaustion. People get symptoms of headache, nausea, vomiting, exhaustion, weakness, dizziness, mental confusion. So there are a lot of ways it can express. And at last, the next step is heat stroke, which is a really serious condition in which the body temperature rises above 40 degrees and people need immediate treatment. And apart from the body temperature, the symptoms people present with are comparable to heat exhaustion, but more severe. So they also get agitated and can get into a coma. And one other symptom in this category is heat-induced seizure. Like we already said, some people with epilepsy can be more prone to seizures due to the heat, but heat on its own can also cause heat-induced seizures in people without epilepsy.
Yeah, and I think it's key to note as well that these are obviously moving elements that can go from one to the other quite quickly. So for example, with some of the testing that we've had to do, we had a wheelchair user sit in a room of 23 to 24 degrees with a 40-50% humidity for 2 hours. And after, I think 45 minutes, that person started to have shaking legs and trembling, muscle spasms, but also start to get nauseous and so on. And that's really an environment I believe, we are sitting in right now in this room. But that occurs quite quickly in a care home, in a home situation, in an office. So it's not very abnormal. Temperatures you need to have quite extreme cases of overheating with certain clients.
For moisture, the scales go from intact, healthy skin without any sweat buildup until stage 4 pressure injury. Symptoms range from sweat buildup to red skin and an irritated skin to excessive sweat buildup to all the stages of a pressure injury. In pressure injuries, moisture often plays a role, but moisture on its own can also cause moisture lesions, or in more medical terms, moisture-associated skin damage. Pressure injuries and moisture lesions are hard to distinguish from one another, so they are taken together in our risk matrix. And there is one important difference between the two of them. That is, there is no stage 4 moisture lesion, because for the tissue loss and necrosis, you really need the pressure component of a pressure injury.
Yeah, and obviously heat and moisture or both combining factors that work together to create these kind of issues. And later on, we'll go a bit more in depth as well on how microclimate, temperature and relative humidity affects skin integrity and can cause these actual pressure injuries.
Yes. In the third row, you find the need for postural support. If someone needs a lot of postural support, normally more of the body is enclosed by the seating system. This results in less parts of the body where airflow can cool someone down. So therefore the skill ranges from occasional wheelchair user, most of them are able to get out of the wheelchair and use a flat backrest and flat seat, to a full postural support system. And if you also need an incontinence cover or coating, they even get an extra point, because this adds an extra layer of non-breathable material, which can make the body even feel hotter.
Yeah, and I mean, at the moment, I think 88% of our business is those people in full postural support systems. But it kind of depends also on the market. In some markets, that's less likely to be prescribed than a normal seating system or contoured. So it depends also on the different reimbursement systems everywhere. But yeah, we often see clients who sweat excessively, who are sitting in a full postural support system with incontinence layer, with a sling and a towel to soak up the sweat, and then the clothes. So you create so many different layers that you really limit the way heat and moisture can actually escape.
Yeah, and what's also important is someone's mobility in the wheelchair. So if someone indeed has a full postural support system and all the other things Corien just mentioned, and someone is also not able to move themselves, heat can be trapped again between their back and their backrest. So the mobility is also important. If someone can change position easily, the trapped heat can get easier away. So yeah, therefore the highest score is given to someone who is completely immobile and also requires a sling to get in their wheelchairs. And if the sling also remains between the client and the seat, this adds an extra point, because it's an extra layer where moisture and sweat has to go through. Then on to our last category, medication use. It's something that gets forgotten a lot when talked about heat and moisture, but it's actually, there are a lot of medicines that can have influences on how the body temperature is working. So for instance, antihistamines, who are a lot of people taking against hay fever, and anticholinergic drugs can impair the sweating process. So it's a lot less easy to sweat, and therefore a lot more difficult to cool your body down. Spasmolytics, on the other hand, can cause excessive sweating, and with that exacerbate the formation of pressure injuries or moisture lesions. For instance, antidepressants cause an increased heat production of the body. So yeah, there's more and more heat you need to get rid of. And beta blockers or other heart medication can have influences on the blood pressure, and with that reduce the skin blood flow, which makes it harder to cool your body down. So there are lots of different mechanisms that drugs work on to interfere with the normal thermoregulation, and therefore it's important to ask if someone is using any drugs. Yeah.
Before we move on to the scoring part of the matrix, does anyone have any questions, or are there any surprises in here that you didn't know? No? Perfect.
Yeah, then on to the score. If you score your patient in each row, you get a total score, and we value heat and moisture more. This is based on the current state of research, because the two of them have a big impact on your health. So with that being said, if your patient scores at least 3 points on one of these rows, heat and moisture management is always recommended. If they do not score 3 points on one of the 2 rows, you can look up the total score in the table and see whether heat and moisture management is not essential or advised or recommended or strongly recommended. And we advise to take in mind the hottest period of the last year when filling out the risk matrix, to make sure that the patient really is aware of their symptoms.
This matrix is obviously launched quite recently. We have validated and spoken to more people and worked with clinicians to launch it. But our next step will be to do a fully validated study with the risk matrix. And we also welcome everyone to use this in the field and give us any feedback, good or bad, so we can start adjusting it, incorporating it. The more we learn, the more this will evolve, I think. But our idea is that you can use it as a tool, much like you're using the Cubitus matrix at the moment.
I already told you a bit about pressure injuries, and Corien already told that I would explain a bit more about it. So here, more in depth, the relation between heat and moisture and the development of pressure injuries. First of all, it's good to know that there are two ways your body can lose fluid through the skin, namely sweating, which is an active process. So that's the reason why someone with a spinal cord injury can sweat below their level of injury, because the signals from the brain cannot travel through the spinal cord to the peripheral sweat glands. But there is another process which is called transepidermal water loss. In this figure shortened to TEWL. This is a passive process. So someone with a spinal cord injury can still get wet and can still have moisture build up at the skin surface. And when you're sitting down all day, you have some form of deformation. How good your wheelchair cushion is, there is also always some form of deformation. And this causes a higher transepidermal water loss, which results in a higher skin surface humidity. And the deformation on its own also can cause a higher risk for the development of pressure injuries. When sitting against something, there is always some occlusion. This causes a higher relative humidity next to the skin and a higher temperature next to the skin. Well, quite obviously, this both causes a higher skin temperature and a higher skin surface humidity. And they have influence on the inflammation threshold of the skin. So you're more likely to develop inflammation. They also have an effect on the friction. You can try rub your finger against your arm, and when your finger is dry, that goes fairly easily. But when your finger is wet, well, mine are already a bit wet because of the heat here, it goes a lot less easy. So there is more friction. So the friction of your skin increases, and together the chance of developing a pressure injury gets higher, actually.
Yeah, and you can kind of think of it in the skin as in the top layer is a layer of bricks lying horizontally, being held together with cement. Heat and moisture is going to start to make that cement disintegrate a little bit. All your bricks are going to point in all directions, and you're very prone to skin injury on those points where the bricks are pointing more upwards. So that's kind of a simple way of explaining the more technical graph. Then moving on to some case studies as well. I've taken some case studies that I think are most relevant for this audience. So Mr. R, this was a case study done by the NHS for 12 months in King's College in London, where it's actually the first integration, one of the first we ever did with the WheelAir system. This is also still our first generation product, and now our second generation is twice as powerful. But Mr. R has cerebral palsy, a learning difficulty, and very complex seating needs due to a variety of issues. So he's 52 years old, and his mom is in his 80s. I think at the time when I met her, she was 85. She's a primary carer in London. They had this tiny flat, but he had 4 fans pointed at him at all times. She would have to wipe his sweat all the time. His back had red lumps. It was one of the more severe cases of sweating I have ever seen. He also had the sling sitting in between him and the chair. And yeah, very, very tough in the way of caring, because he had to be lifted with a sling 4 times a day to change his clothing because it was just completely drenched in sweat. After the WheelAir, they've now been using it for 3.5 years consistently. So now we're down to 1 to 2 t-shirt changes per day. The skin redness has gone. It's just happier quality of life, less care needs, and more comfort. So really nice results. Similar results for Jamie. So Jamie, rather than a WheelAir Care system, had a WheelAir Go sling back. So for him, he was in a care home, also with learning difficulty, non-verbally communicative, and suffered from epilepsy seizures. So here's carers had already identified that those seizures were predominantly due to heat. And that's why his mom got in touch with us for a slingback. So one of his problems was that also due to the heat, he would get skin irritation that would start to infect sometimes, and he could not participate in his hydrotherapy. That in combination with the seizures for which he also had to take antibiotics. After the WheelAir, he's also been using it 3 to 4 years now. There's no more seizures to the heat that have been reported to us. He's able to sustain his therapy sessions and just participation also in activities, which can be really important for someone in a care home like that. Moving on to our testing. Previously, we had done some temperature testing, but we'd never actually been able to look at relative humidity. But now we took the ISO 1684011 testing, which is designed for cushions, but we adapted it to also fit with our slingback. And with those sensors, we measured the temperature and relative humidity between the backrest or seat cushion and the persons. So that we actually measured that microclimate. We did this with the fan box on and fan box off, and then measured the difference between the two. So if you look at published research from several studies, actually, you can see that the temperature can start to rise 2.2 degrees in half an hour if you just sit against something. And obviously then depends on what type of seating system you use as well, how much that will be influenced. What we saw here, for example, with our slingback is that the temperature over a 2-hour period rises quite significantly with the fan box off. And then if we turn that on, it really reduces. So we measured up to 9.2 degrees difference for the slingback in temperature. With one of the cushions, we measured 40% difference in relative humidity. So really significant differences that we're able to obtain. So we've published everything in like a proper way of presenting results with an abstract and introduction. So that's all visible on our website. We're hoping to publish these soon as well. For the slingback, we've just done it with the slingback. For the cushions, we tested it with 5 different cushion types so that you see with a different cushion what kind of the effects would be. And we aim to elaborate on that as well so we can test more different types of cushions. I do have to say, if it's a full plastic cushion, we don't really work yet because I haven't created something for the air to go around it, just underneath it. So then it's maybe good to look at an air permeable cushion. But yeah, it's something I want to work on in the future as well.
Yes, in the beginning we had a nice figure of apparent heat, and to make our test results a bit more clear, we plotted our results in this figure. So now you can see that with the WheelAir on, you are in the same apparent heat category as the room, because the room was about 23 to 24 degrees and had a relative humidity of 35%. But with the WheelAir off, you see that you are in a lot higher category because the temperature rises and the relative humidity also rises. So you can see that the WheelAir really has a big impact on also how your body perceives the temperature.
For those who are visual as well, I've added this in. This is infrared imaging that we take sometimes during assessments as well. So here we had someone sit in the manual chair with a slingback on. On the left is after 10 minutes. So purple is cold and yellow is hot. So you see that even after 10 minutes, the temperature rose quite significantly, while previously normally an object is the same temperature as the environment if it doesn't have anything special in it. We then turned it on after 10 minutes, and you could immediately see how the color of the slingback is actually starting to stabilize with the outer environment. So in 10 minutes, quite a big effect already. So now coming on to the product part of the presentation to give you a bit more of an idea of how we actually aim to prevent these issues and help treat them. So with our WheelAir system, we actually accelerate mechanisms of heat loss that otherwise naturally occur, but not for everyone, and we accelerate them. So the mechanisms of heat loss are evaporation, conduction, convection, and radiation. Now on radiation, we have no influence, that's just the environment. But convection, conduction, and evaporation are the ones we focus on. So when you see someone going to, like a wheelchair user who can't sweat, for example, and he's using a water spray or putting a wet towel on, is to create an artificial sweat loss. So it's putting wetness on the skin so that it can evaporate and you can create that heat loss. Now we are going to accelerate those mechanisms by blowing air onto that. We prevent sweat from building up, but if it is there, because we blow on it, we help it evaporate quicker so it will cool you down quicker. Conduction is because the whole surface, we work, as you can see here in the sling back, with 3D spacer meshes. That surface would actually become cooler as well, and you touching that actually cools you down. And then we have the convection, of course, which is a flow of air passing your skin and taking away hot heat cells as it travels. We've got this available for all types of seating systems, and we've divided into 2 different lines. So WheelAir Go and WheelAir Care. WheelAir Care is the line that is ready for integration. So these are our components as kind of like a Knex for adults, where LC Seating knows exactly which components are needed for your seat, but it makes that they can make all sorts of different customizable adaptations, which I'll show you some pictures from later as well. WheelAir Go is more for manual chairs or light power chairs, or those who use a normal cushion. And LC Seating is also our distributor for those in Ireland. So WheelAir Go cushion cover, it's not with a cushion, it's just a cover where you can place your own cushion inside it without an existing cover and create a microclimate cushion cover. And the sling back replaces your current backrest, and it stays on the tension adjustable straps that come underneath it. I have some more photos of that later. Luke, do you want to say a bit about the client you did this for?
Okay, this is the child is Timothy, and we actually just handed over this system yesterday. This is the second system that Timothy has with the WheelAir system. As you can see, as Corien's saying there, we made some specific adaptations to bring it into the headrest as well. This little child has got a hydrocephalus, and also sweats a lot on his head. So, and it's just as you can see, the mold, that the top part is his head, and the lower part is his trunk. So his head is as big as his trunk. So, but there is obviously a lot of surface area there that needs to be cooled as well. So we just had to get creative with a little bit of with the tubing and some different types of connections, and that was as I said, the result of it. I think we have a couple of more pictures there of the system when it was finished. So there was a couple of different bits and pieces added onto the back of the chair as well, but we actually went to a more flexible tubing that rather than the guy's tubing, that just we felt that it was working better for us in that situation. So that's why you can see there's a slightly different looking of tubing. And we just, as I said, we had to get the plumbing expertise onto the scene. So but so far, as I say, the mother was delighted with the first system, and whenever we went to remold, it was just right. Well, we're getting the WheelAir again was Mum's first request, and we made some alterations to the way we'd done this second system as well. The first system we used the 180-degree system, where it comes out, the tube comes out at the bottom of the paddles, but in this one we used the 90-degree system. Yeah, so the 90-degree system we found is a lot more user friendly for clients taking their covers on and off, because what we were doing was we had to, on the 180-degree system, they had to disconnect the tubing and then take the covers off and then reconnect. But now by using the 90-degree system, it's much easier for covers to go on and off for washing as well.
Yeah, exactly. So we have all these different components. So for example, the 90-degree system can be a variation like this, where you can build that in like this. You can build it in upside down. Each time that clicks into the fan box, which attaches then with a clip. But we also have, Y connector to make more channels, or a lengthening. So you have this tube that you can play with. But yeah, you don't have to use this exact tube as is if you need a customizable solution. Like, anything is really possible. And then I've added in one other solution as well to show you how it's typically integrated. So you can see here that you can put it upside down, you can go from the top and really easily just make 2 holes and put it inwards. So if you have someone who has backpacks that lie here, or you have a special power chair that has a unit here, you can actually choose where the fan box should sit to be most out of the way of all the other components attached to the chair. Sling back and cushion cover. Here you see it with a variety of different cushions. So yeah, quite self-explanatory, I think. And we can also help to see what size is needed, but you basically measure the current size of cushion you currently have, or of the backrest, and then match that as closely as possible with our size range. We also have some accessories now. So lumbar support cushion that's very breathable to put inside the sling bag for those who need better postural support but still want to use the sling bag. And we have our own tension adjustable strap system as well. I've put this slide in because that's often a question we receive is, well, my client has incontinence issues, what to do now? With our cushion cover, there is a trade-off. We cannot blow through covers that aren't air permeable. So if you have someone who suffers from incontinence with a cushion, we suggest using maybe a sling bag because, yeah, just no other solution yet. In future, I have some ideas that I might get a way around that. With custom seating, we then suggest putting it in the back, as we've seen with the solutions here, rather than putting it in the seat. If you want to put it in the seat, you could, for example, put it on the sides as well. So there are ways to play with that. We have clients where the back still gets some issues as well. So then they've made the bottom of the back with the incontinence liner on top, and then from there a bit higher, you start with the airflow section. So you can talk with Luke and just see, you know, what the needs are, so we can create a custom solution for your client. Sleeping system as well. We often get put into custom seating that's for sleeping. So then you can actually place the channels in areas where, you know, incontinence isn't going to be an issue, so you still get the ventilation in there.
Yeah, the cushion cover can also be washed. So if someone is not too often incontinent, that's also an option to do.
Yeah, and the sling bag, of course, as well. So we've made it so every single part can be taken apart, everything's modular, everything can be taken off, washed, replaced. So also if there is a breakdown, we can just repair one single element rather than the whole thing. Some features as well. I don't know who's all seen the product already, but here is the fan box. So the fan outlets are here, the inlets are here. So they suck in the air that gets pressurized internally and then pushed upwards. You probably all have experience with custom seating and then a computer fan being put in the back. They've been doing that for the last 30 years, make some holes and attach a battery. It's often a non-regulated, safety-regulated solution, but also you're blowing air on one specific spot quite intrusively. And what we then see is that people only turn it on when they've reached a point of overheating because it's so loud and intrusive, but then it's actually already too late. So with our system, I'll show you how silent it is. So this is it on now. Nienke has had both the cushion and the sling bag the whole time on full blast. But yeah, we have 6 different settings. The boost one you do here, I assume. I don't know what you hear. But that's kind of the trade-offs on the top, on the highest setting. People often use that just for a quick boost. It lasts then 4.5 to 6.5 hours. But the intention is that you use it on the lower settings and then you have 27 hours of runtime out of it. You charge it on the USB-C fast charge, which is here. And then the remote control has a USB port that's here. For those who need it, you can also use this as a power bank if you're out of battery on your phone, for example. And as I said, yeah, all our parts are replaceable.
Yeah, you can operate it with a small button that is on the fan box itself when you lose your remote, but you can also operate it with your remote.
Yeah, exactly, the remote. Do you want to maybe give a quick overview of how you use WheelAir?
Yes, yeah, like Corien said, I have both the sling bag and the cushion cover. I had it reimbursed due to the fact that I had a pretty severe skin rash due to the heat, and that got infected and I got pressure injuries due to that. When I'm hot myself, I usually use the sling bag, because the sling bag has the most impact on my total body temperature. But for instance, when I'm going for a hand cycle ride, I also use the cushion cover to prevent my butt getting wet from all the sweat. Yeah, so sometimes I use both, and sometimes one of them is enough. I think that also really depends on your client's needs.
Yeah, exactly. So you might have a custom seat. If it's extreme sweating, you might want to put it in the seat and the backrest, but we've actually often found that the backrest alone is sufficient to cool down the whole body. Case studies. Case studies is something that we keep hammering on because we want to elaborate our clinical research. We also have a research pipeline, and the more feedback we have and inputs, the more we can plan what exactly we want to do further research around. So if you have clients who use the system, we have a questionnaire as well that Nienke can give some more information on.
Yes. For clients who already have a system, we have a set of questions that can be asked to the client. But for the clients who got the system new, we have a pre and after questionnaire to look whether there is a difference in perceived symptoms, perceived comfort, on an influence on daily life. So really to measure the impact our WheelAir system has. So therefore we have some questions we ask before someone is going to use the system, and after a 2-week period of using the system. Those questionnaires can be filled in on paper or via Google Forms online.
Which also brings me to our next steps. This is where LC Seating and I would like to do further research together, which would like to involve some clinicians from Ireland and clients. So what we want to do now, we have the ISO 1684011 procedure with the cushion cover and sling back. We now also want to progress that to custom seating. So we are looking for clients who score quite highly on the risk matrix, who have symptoms of heat and moisture, and actually want to try the system so we can see over a 2-hour period what the measurements would be. So our testing consists of 2-hour temperature and relative humidity recordings, and then also questionnaires so we can put a metric measurements to all the other factors such as quality of life, comfort, pain, and so on. So we're looking for clients and clinicians willing to participate. You can message me or Luke if you are interested in doing so, or if you know other people, you can obviously pass this message along.
We already have one signed up for that one, Corien. So it's yeah, we're happy to proceed with anybody else as well.
Perfect, and then yeah, that's actually our presentation. So I hope that was really informative, and I'm keen to hear whether anyone has any questions or comments. No? I'm trying to stop sharing. I am not able to stop sharing my screen, so I can't see if there's any chats or comments. But yeah, if there's no further comments, then this is the end.
Yeah, if you do have any questions, any clinical questions, you can reach me, for instance, at nienke@wheelair.co.uk, or just mail at the info address and they will send it to me.
Perfect. Luke, any final words of wisdom?
Of wisdom, maybe not. We got to thank you, but no, thank you very much to both of you. So that was very informative. As I say, yeah, we've been using the WheelAir system for this last couple of years, and yeah, we're really finding like the clients that you go into, and especially in custom seating that we've seen, and you go in and really high tone CP, high tone usual type of stuff that we're seeing in clinics, and the feedback is that we're getting is that this works. It really works. So it's and then as that client that we showed the one that we delivered yesterday, it was the first thing that Mum was requesting about with the new molded seating. Can we, are we getting this into the new system again? It was like, yes, we are. So it's like that system that we done. We reused the fan box, and it was just a case of new pipe work and everything was put into that for that client. But yeah, no, it's working fantastically. We haven't as of yet. I think when I see one of my colleagues is on, we may be doing one with that's coming in on the sides of the seat, but we haven't done any ventilation up through the seat on any of our custom seating. And just obviously with incontinence, it is usually something that goes hand in hand with custom seating. Not always, but sometimes. So yes, we've always been wary of putting lots of holes into the cushion, but we are also working on different solutions around that. As you said, it's just coming into the side from the side. So but it's a fantastic system. Yeah, as I say, we're very happy with the results we're getting. So look forward to getting some contacts from people within Ireland to work some case studies with us, and yeah, looking forward to getting that underway.
Perfect. Yeah, and if you know, if any of the audience here knows anyone else who would want to learn about this, or you think we should come present this somewhere, we're happy to provide more information and do this again to more people if desired. Because as I said, we want to really contribute to that education and conversation around the topics of heat and moisture. Okay, great. Well, thank you so much for attending the webinar, and I hope to meet you all in real life at some point, and you know where to find us if you have any more questions. So thank you very much for your time.